Hey, it's Dr. Miller here, and I want to teach you how to take care of your JP. If you have a JP drain, this is the bulb. This is what's collecting the liquid that's coming through this little tube, and the tube is going into probably your neck if it's draining your neck. So the most important thing to do is either you or your caretaker has to sort of, and it's called milking the drain. So every couple of hours you want to sort of go over and sort of pinch the area near where it's going into the wound, and then just sort of squeeze down because you're milking it, and then you can sort of advance and milk it down and advance it and milk it, and you're just making sure that nothing is getting stuck into the drain itself. So once again, you sort of pinch up here, pull down towards the bulb, pinch, pull, is compressed, and it's actually sucking the fluid out of the wound. And so it looks a little bit like this, and you probably won't have as much liquid in there as I have here, and it might be a little bit red tinged because it might be a little bloody. So the first thing you're going to do is you're going to take the top off, and that's this little pop right here. That's a little stopper. You're going to undo that, you're going to pop it out, and when you do that, this expands, okay? And when it does expand, you're going to go ahead and mark how much liquid there is. Now, you probably aren't even going to have to do this. You'll only do that in case it does fill up with a lot of liquid, and then you just sort of walk over towards a sink, and then you can just squirt it out just like this. Okay, or if you have a cup, you can just squirt it into the cup and do it. That's easier probably. And then you've got this inflated bulb that you have to put back on suction. So the way to do it is you just compress the bulb again, so it looks like this, okay? I'm showing you what it looks like, but the easiest way to do it is just to take your hand and squeeze it nice and tight. And then with your other hand, you're gonna go onto this little, onto the top, and you put the stopper back in the hole, okay? Remember, you've taken the stopper out so that you could express the liquid, then you squeeze the bulb, put the stopper back in, and now when I let go, it stays compressed and it continues to supply suction on the drain. And I'm just going to attach it back to my shirt, and again, just grab one end and milk it a little bit as it goes down here. And most of the time you won't even have to unlock it, drain it, because usually the bulb doesn't even fill up that much. But in case it does, now you know how to do it. That's how you manage a JP drain. Hope that helps you. Look forward to seeing you tomorrow.